Hi, I'm Dr. Tay Sha Howell. I have direct wound care and consulting in Edmond, Oklahoma. The group asked me to talk a little bit about my journey, how I left the hospital-based center and decided to open my own direct specialty practice. And so a little background, I was born and raised here in Oklahoma and did emergency medicine residency here and practiced across town at Integris Baptist for 10 years. Had a time in my life where I needed to make a switch, mainly for my family. And so that's a whole different story, but I transitioned from emergency medicine to wound care. I got boarded in, subspecialty boarded in undersea hyperbaric medicine, and HBO, and started doing wound care in a hospital-based clinic in Midwest City, and then had an opportunity to be a medical director for the Norman Wound Care Center. So I switched there, and I did that for 12 years, running the inpatient program, the outpatient program. And when I started there, it was a little, part-time clinic, no hyperbarics. We added hyperbarics, we added doctors, we got a bigger center, we added more doctors. I worked on formalizing the inpatient program and also got interested in diabetic limb salvage and helped the hospital develop the state's first diabetic limb salvage program. Very comprehensive inpatient, outpatient, and found a lot of satisfaction with that. Loved making a difference. I was really interested in trying to scale that, grow that to the next level. But my hospital was a community hospital, so there was no path for that. And we tried to partner with some other entities, and it just never really came about. And so all of a sudden one day I'm like, well, I guess there's no other big projects on the horizon, and I'm really just gonna look at running this center and taking care of patients, which I love, but then with no distraction of this other project, all the hassles of the day-to-day stuff, the fighting the fight for the patient, the peer-to-peer talks with non-peers, and just all the bureaucracy and the crap, that was all I could really see. And I'm thinking, oh my gosh, am I really going to do this for the next 10 years or whatever? I don't think I can do it, but my gosh, what am I going to do? You go into medicine thinking this is what you're going to have, and this is what every physician that I know still does it for and wants it to be like this is what you think it's going to be. It's you and the patient, and you're helping them and you're figuring out their problem. But really, this is what it's like. I mean, it's you and the patient in the room, but there's like 10 people, not literally in the room with you, but there are all these entities telling you and the patient what each of you can and can't do. And it's, Dr. Brown yesterday talked about the moral injury that physicians have. I mean, it is demoralizing. You're trying to do the right thing, and you're just banging your head against the wall trying to get it done. And she also mentioned, you're working harder, you're working longer at stuff that's not. It's not this. It's just fighting the fight with this problem here, and so. I felt like I was a hamster on the wheel, just, running as fast as I could. And you're trying to see as many patients as you can a day, because that's what the system creates. And, you're making less money. But besides the money, I was just angry all the time. And it just bleeds over into everything. And so, classic case of burnout. But I honestly would, if you'd said, do you feel like you're burned out? I'd say, no, but blah, 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 blah. I have some, complaint about something. But anyway, so, why would I leave my, big, prestigious job where I was taking care of lots of people and making a really big impact. Well, why would I stay? Because, you kind of get it to a point in your life where you're like, I don't really think this is worth it. And I'm really not sure I can keep practicing medicine. But I didn't want to leave patient care. I just didn't want to practice like that. And I couldn't envision how it was going to, happen. So the next step was sort of an exploring process, trying to be open to opportunities and look at things a little different, think outside the box. What could it be like? What might I do? And ended up having a conversation, a coffee with Jay Kempton. We were, socially acquainted, and a mutual friend reminded me, he's doing something with cash pay. Why don't you talk to him? And so we had coffee, and he introduced me to the Free Market Medical Association and the idea about direct primary care and about the surgery center and what wound care might look like. I mean, he didn't really even know what wound care was all about, but he was, as he is, creative and forward thinking about what some opportunities might be for me. And so he encouraged me to try to find another physician anywhere in the country that was doing, pure wound care on a cash pay basis. And I searched and could not find anybody. And so I'm thinking, well, if I want to do this, I'm just going to have to make it up as I go. So I need to really, get a lot of background information, a lot of, talk to folks locally and try to figure it out. So right after that coffee, he did 4 email introductions to some key physicians that really helped me decide, I'm going to try it. And so he got me hooked up with Dr. Rice with Oklahoma ER, and Dr. Rickner with PHP, and Dr. Keith with Surgery Center, and Dr. Susan Demick, who's since retired, but she was doing cash pay lipidemiology for like 25 years. So she was really a pioneer in that specialty practice. And so, of course, none of them are doing wound care, but they've got ideas about how I might build that practice and what they went through. I mean, as far as even just little functional tips, like, you might try this app, or that, like you don't have to hire somebody to answer the phone. You can have this Spruce app and, things like that. So I sat with all that information and, brainstormed about it. And it was really 2 years probably before I made a decision and decided to leave my practice. So I didn't go into that lightly. I did find a Facebook group about direct primary care, which was really helpful. And now that has grown tremendously, and there's a huge following of direct primary care doctors and now direct specialty care. And so it's just, practical tips and support, networking. So much like this FMMA, but, a little more nitty-gritty details about practice and stuff. So I wish a lot of that had been there for me when I was first making the decision. But it's out there now, which is great. And there's a lot of, books and resources, coaching, online courses about how to build a direct specialty practice. There's now, I've learned about something at the meeting, with a whole a business helping support physicians to go, build their practice. So you have to decide, if you're already in the traditional model, you've got to decide, well, how am I going to support myself? Like, am I going to take out a big loan? Am I going to just do a hybrid practice where I do some cash pay and some of the traditional insurance stuff? Am I, going to do full cash pay, but then do some unrelated side gigs? So there's lots of stories in these groups and LinkedIn and stuff about how people manage that. For me, where I was in my career and my financial situation, my husband's a physician, so I didn't have that financial pressure of I've got to go out and, figure out how I can make it quite, I didn't have quite that financial pressure, which I feel lucky that's not always the case, but you got to decide if that's for you. So I had a slow start. I left my job at the end of December of 2019, thinking I'm going to take a family vacation, a little bit of a break, and then start in the spring. And then the world shut down. And so I ended up with a nice long sabbatical that was probably very much needed and not really planned. But so at the end of 20, I actually opened my doors. I have what's called a micro practice, meaning I don't have any staff. So that helps keep my overhead low. I am, cleaning the room, changing the dressing, doing the vitals, doing the procedures, the debridements, scheduling, taking payment, that's all me. It's very, been a long time since I'd actually taken vital signs on a patient completely just by me. But at the same time, I'm a real control freak. And so it was really nice to be able to know every single thing about what's happening with their supply order. Did the records get sent? I know the answers to all that because I've had to do it. I subleased a space initially, and that was fine until that doctor up and just abruptly decided that he was going to go to an employed contract at the hospital that I had just left. So we just switched places, but he wasn't in wound care. But anyway, so then I'm kind of in a lurch, like where am I going to practice? And so I ended up in my own space, which I didn't really want to take an overhead on initially, but I also didn't want to be in that position again where I had to, figure out where I was going to go. I had a hard time figuring out, that was one of my challenges, how do I price my services? Because it doesn't lend itself to a subscription model. My goal and the patient's goal is for us to finish our relationship as quickly as possible. They, heal up and kick them out. And so I had to do it, at the time of service, trying to figure out what do I think my service is worth. I think physicians as a whole undervalue their expertise, their time, and so that it feels kind of icky to put a number to, you're ingrained in the traditional system that's all removed. Somebody else sends the bill, somebody else sets the price, other entities are deciding your worth. And then when you're on your own, you're like, well, I guess I want to make this much an hour. You're just, again, making it up as you go. Another thing that I've learned to do in my practice, I actually learned from my experience with improv. So I did improv theater for a few years, and there's a tenet there of yes and. So when you're on the stage and your partner, your scene partner says something or, acts out something, does something that you were not anticipating and it really wasn't where you were seeing the scene go, you can yes and or no but. And so even though you've got this great idea that's going to be hilarious or whatever, they do this. And so because you're building trust with your partner, you yes and you say, yeah, and then we're going to, you just jump right into whatever crazy thing comes in your head. And I've felt like I've really had to yes and in my practice a lot because I'm making it up. I didn't really have any framework for how it was going to look. I never dreamed I'd be doing some of the things that I have been doing. And, it all works out, but you have to be open to it. And, I sort of now say never. Like, I could consider doing that. Let me think about that. Let me get back to you. But that has been some of the creative and entrepreneurship that I found a lot of personal satisfaction in my old life of building those things. It's just now smaller and it looks a little different. It's also been a part of my journey to educate and advocate for the transparent pricing, the direct primary care, direct specialty care. I'm educating my patients on that. I mean, some of them, if they come from PHP or whatever, they already know. But, patients don't really realize, like, how does this really work? Or other doctors. I've had so many colleagues go, you're going to do that? Well, it'll be real interesting to see if you make it. Like, real dismissive, not thinking that, they weren't very optimistic. So it's been kind of nice to be like, yeah, I'm still here. I'm doing fine. And so it's been educating some of those other physicians as well. The challenges have been, I'm not a business person. I have no business background. I don't know anything about that. So, every little step of the way that's setting up your own business and running that, what money do I spend on marketing? What does that look like? That has all been pretty challenging, but I'm, determined to succeed, and I have no qualms in saying, I don't know how to do this. Can you help me? And I know a lot of smart people. So, you just utilize your resources to, to build it. And the rewards have been, I'm staying in medicine. I'm taking care of patients still. I get to do what I love. And it looks more like that first slide where it's just me and the patient. I have a lot more time with my patients. They love that. And so I think my healing, percentages and outcomes have, remained good. I feel like they may even be a little better because the patients, I have a more personal relationship with the patient. And so better able to get more buy-in, a little more time to educate, and things like that really make a difference for those chronic wound patients. So some of the frequently asked questions that I've had along my journey are, if you don't take insurance, then can you order all these things? Can you get the things for your patients? And the answer is yes. So I opted out of Medicare, but I still have what's called a PCOS number, so I can order things. And if they meet the criteria for Medicare or for their commercial insurance, then they can use their insurance to have those services or tests done, et cetera. I do sometimes write down ICD-10 codes and CPT codes for patients to submit their own invoice to insurance. I don't have too many patients that do that. It's not been super successful, but they can try to submit it as out-of-network. They may or may not get much out of it, but it's an option. I'm happy to do it. I have a very simple EMR really built for primary care that I've sort of modified to make work for my wound care, and it supplies the numbers there that we need. The big one is really, are people actually willing to pay out of pocket for specialty care? And the answer is yes, they are. And they come to me with various payers and from, various financial situations. So I have the truly, they don't have any payer source. They are just, working, living month to month. But if they really need wound care, if they're trying to go to a hospital-based clinic, it's exorbitant. The prices are insane, and so they could never afford that. If they have commercial insurance, might have good insurance, but if it's a high deductible plan, it's still less expensive to see me or the same. I have lots of patients that are Medicare in a secondary, so they could pay $0 and go anywhere they wanted to in the city, and there's lots of choices out there. But they come to see me because their doctor insisted they come see me, or they've been to several of those centers and weren't getting well. Or especially for that age demographic, they want that old-fashioned medicine. They want to go back in time and have that longer time with their doctor. And so, while I'm taking their vitals and taking down their dressing, we're talking about their blood sugar and their nutrition and their, how are they offloading? All of that is happening seamlessly, but they're just getting all this, 30, 60 minutes with the doctor, which is unheard of in any of the other wound care clinics. So it has been really interesting. I had no idea who would come see me or what their payer source was, and it's a little bit of everything. One big payer source I have, of course, is the Kempton Group. So I am a KPP, or a Kempton Preferred Provider, and so I have patients that drive 2 hours one way to see me because they don't have any expense. And that's been a very, we have a 2-page contract. We set my fees. I don't get any hassle. I get what I need for the patient. So that's, beautiful. And I wish there was more of that in the world for all patients. But anyway, and so I also get asked, are you making any money? Well, yes, I'm making money. I'm still in practice. Do I make the same money? No. But I am practicing totally different. So, I was working 60 hours a week, the hamster wheel. So I work, probably half that, give or take, sometimes less than that. So my patient volume is way down. My life is so much happier. I'm happier. I'm a nicer person. So if I had transitioned to this, chosen this at a different point in my career, I could make as much money. There are patients and avenues and pathways that I haven't gotten around to explore. I'm not hustling like I used to in a different, practice world. So, but it is possible. And it's taken a few years to get there. I didn't know if I would ever really be able to say that, but it is possible. Okay. So this is a nice summary slide. I borrowed this slide from Dr. Nguyen. She is a direct care podiatrist, and she does some coaching and stuff. But I love this slide as a nice, kind of summary of what your life is like in the traditional model and out in direct care. So, the drastic difference in the patient volume and the overhead and how much time you spend with your patient is, this is so true. And then, quality of life, I will frankly say with insurance, it was horrible. And, now it's good. It's kept me in medicine. I would have ended up quitting. So I'm still able to make a difference for patients, just in a, smaller number. So any questions about any of that?
Moving into this method of practice from what we'll call a traditional practices, what do you feel is your biggest struggle and how did you overcome it?
I think it was trying to figure out just running the business. I got a lawyer, an accountant, my billing consultant from my old practice gave me a lot of advice about just structuring and how to think about, how do I want to price it? Because in the traditional model, it's based on, the procedures. But it ended up, I had to, figure it out. Basically, how much money do I want to make an hour? And whether that's an hour of we're just, talking and education, or if it's an hour of a procedure, so that was all just, I had no idea about any of that. And again, I could find other doctors doing direct pay, but as far as the world of wound care and how that is structured and what I was used to, I had to, sort of make that up, so. Yeah.
Are you able to get better deals on Regranic, satin grafts, and all those expensive repair products?
Better deals? Not really. Regranics is coming, through the patient's pharmacy, or whatever their pharmacy benefit is. The grafts, I have been, they cost what they cost. And so the cost to, a private practice doc that takes insurance is the same cost to me. So I don't really get a price break, but it's transparent with the patient. Okay, I just say, this is my cost. I have a service fee, which is a standard thing, and I have a procedure fee. And so here's the breakdown. And so we can look at, a $600 product. We can look at a, $2,500 product. and, you tell me, like, how much do you have to spend on a car or a refrigerator, right? Like, the patient decides. I tell them, like, I think we're at a point where you might benefit from a graft, so here's the, type of graft that I think you need. Here, they're a dime a dozen as far as, you got a ton of options, right? So I think that, these 3 choices and these are the prices, I think this one works, but, and then the patient decides. But again, it's just the 2 of us in the room. And yeah, their wallet is a dictator, but that's on them. And so it's the same even with just plain supplies. Like, some of the wound, just not advanced therapy, but regular wound supplies are really expensive. And so I find that kind of a fun challenge to be like, okay, well, this is what I think you need, like a general type of therapy. And then these are the options. And we just kind of go through the different levels and help them.
Do you have a hyperbaric chamber?
I do not. So I have a 1-room office. I'm still board certified in hyperbarics. I do hyperbaric oxygen consultations for patients, like if their doctor has thought, oh, you might need HBO, or lots of patients are, everybody's like reading up on their own, so they'll come and say, I think I need HBO. So I can help them sort out if that's if they're going to meet criteria, if there's any contraindications or reasons that they shouldn't. And then I refer them to my colleagues that are still at the other wound care centers where I know they'll get good care.
I'm not sure if this question is too personal or not, and you don't have to give super detailed answers, but how long did it take before you felt like things leveled out and you became cost profitable?
About 1.5 years, almost 2, probably. Yeah, I don't mind answering that. I mean, everybody's like, can you really make a living at that? So again, there have just been so many opportunities that, are on a to-do list somewhere that if I was really hungry or really pressured financially, I would have been much more active in pursuing. I'm just not there in my life at my age or stage or whatever it is. I swore when I left Norman that I would never work like that again. And my husband's so proud that I have not reneged on that.
Do you find yourself doing a lot of primary care? It sounds like the time patients are asking you more questions maybe than primary care.
I wouldn't say primary care because I really stay in my lane. But when they're having a diabetes, issue, then I'm talking with them, counseling them about some of that and saying, you need to get with your doctor now, or your heart doctor, or, whatever. So I'll talk to them about it, but I try and stay in my lane. But a lot of our time is spent on like prevention, recurrence, maintenance, that, just trying to open their eyes, because there's so many factors into it. Usually by the time somebody is seeing a wound care physician, there's a bunch of stuff going on, and it's not always just, oh, it's infected and needs antibiotics or whatever.
Since you took the DIY route more, would you, looking back, if you were more of a mentor, would you suggest using more, like I work for Freedom Board, so we help support women TPCs. Would you suggest doing that, or more say, you can, because we believe, we want to support whatever route you choose, but I'm curious to hear, since you took that route, you say that was a big struggle for you. Looking back, how do you feel?
I would have loved to have explored more of that. Like doctors don't, well, not every doctor, most doctors don't want to be business people, and that's not really our gift. My gift is taking care of patients. It's not, figuring out or running a business. And so I would have loved that. I would have so pursued that had I known it or had an option. So I would highly recommend getting, that one about find your resources, or lean into any of that, because it's hard.
I was going to say, I'm always so curious to hear, I talk to physicians daily and they want to take that DIY route, and I'm like, good. Like if you can do that,
Yeah.
and you have that capacity, that's so great. And so I'm always wanting to hear at the end of it how it went and looking back if it was easier. You know, like when you said you had to figure out the pricing structure, how did you decide? You know, when it came down to it, how did you end up deciding what you were going to price?
Well, I had advice from my billing consultant, and you know, just her recommendation to figure out how much you think you want to make an hour or whatever. But I've tweaked that, you know, like it's still a work in progress, right? But you know, I mean, there are times where I'm like, I'm sure I've lost money with that encounter, you know, because I've spent 2 hours doing all this behind the scenes stuff after they left, but yeah. All right, thanks.